My dear students, I would be giving you a clinical scenario today, and the clinical scenario will decide the topic, and then we go about the topic. So say we have a young child who has got multiple fractures at multiple parts in the body, and the fractures are in a different stage of healing. What can be the probable diagnosis? So one thing which can come to our mind is child abuse. Now, I say the parents are not abusive to the child. What is the second thing which comes to your mind? So today I'll be talking about the collagen defect disorder, which we give the name as Osteogenesis Imperfecta. You have to remember physiologically the role of collagen in the body and the types of collagens in our body. So basically, this osteogenesis imperfecta is a defect of the collagen. And you have to remember, I always just stress upon the fact about the synonymous names. The synonymous name for osteogenesis imperfecta happens to be brittle bone disease. Although a misnomer, why I will be getting to that. Then we also give the name to the same disease as Lobstein syndrome. So osteogenesis imperfecta, Lobstein syndrome, brittle bone disease. Now you have to remember that collagen type 1 is mainly involved in osteogenesis imperfecta. There are multiple types of osteogenesis imperfecta, and you have to remember that type 1 happens to be the commonest. And the pathology basically lies in alteration of important genes, and the genes which are implicated in osteogenesis imperfecta happen to be COL1A1 and COL1A2 genes. So you have to remember these two important genes. Now, how do the children present? They can present with osteopenia. They can present with multiple fractures. Say fractures of the upper limb, fractures of the lower limb, and fractures at different stages of development. Now, in addition to that, there can be associated skeletal deformities. Now, I just told you at the initiation of my class that brittle bone disease is a sort of a misnomer, because it is not only the bones which are affected. In addition to the bones, there is this very important fact that there is a joint laxity, and that joint laxity causes hypermobility. So you have got the bone being involved, yeah, sure, and in addition to the bone, you have got the joint laxity as well. The joints tend to be hypermobile. Now, after that, you have to remember that this osteogenesis imperfecta can present in a newborn, and a child can have had in utero fractures as well. So the fractures might have developed in the womb of the mother as well. So in utero fractures can be very classic of a child born with such a disorder already. Now, I happens to be a focus in osteogenesis imperfecta, and I've been seeing that many questions have been asked about the eye signs in osteogenesis imperfecta. You have to remember that we usually and classically associate blue sclera with osteogenesis imperfecta. Fine, that's fine. But it is not always the case. You don't find blue sclera in all the cases of osteogenesis imperfecta. Sometimes there can be, instead of blue sclera, a grayish type of sclera. So blue sclera as well as gray sclera are important features of osteogenesis imperfecta. Then you remember this planet, not the Venus, not the Mars, Saturn. Saturn is a planet, and it has got an eponym in osteogenesis imperfecta. There's a ring which we call as the Saturn ring associated with osteogenesis imperfecta. Then arcus juvenalis is an ophthalmological finding in case of osteogenesis imperfecta. In addition to certain cases of detachment of the retina, so retinal detachment also happens to be important in case of osteogenesis imperfecta. So 3 classically ophthalmological features. Number 1, the presence of blue sclera or gray sclera, the Saturn ring, and the retinal detachment. Now, in addition to that, osteogenesis imperfecta can present with something else, which will be more important to a dental surgeon. Dentogenesis imperfecta, so in which we have the malformation and the maldevelopment of the teeth. So it is not only the bones of the skeleton being affected, the joints being affected, the teeth being affected, and what is classic about the bones have got this typical, what we say as the Vermean bones. So Vermean bones are pathognomic of osteogenesis imperfecta. In addition to that, popcorn calcification is usually seen in case of osteogenesis imperfecta. So you have to remember basically this connective tissue disorder, and this connective tissue disorder, osteogenesis imperfecta, has its fundamentals in collagen. I hope you just have given an undivided attention to what I have just narrated, and this thing happens to be very, very focused and high yield about osteogenesis imperfecta. You can scan the question papers of the last years and just have a look. You will be finding that lot many questions have been asked, and I hope that those who have watched me would be benefited in their future as well. Thanks a lot.